Well, good afternoon, everyone. I see everyone starting to join the call. We are going to start in a minute or so. Well, it's 1 p.m. sharp. Good afternoon. Welcome, everybody. It's a pleasure being with you here again today. I am Ezra Calvert with Entrada Insights. Just a couple housekeeping notes. All lines are muted. We are going to have two wonderfully smart guest speakers with us today. We'll hear from them, and then we are going to open the forum for questions and answers using the chat feature. Our guests today are Dr. Lori Pennington-Gray. She is a professor at University of Florida. She leads the tourism and hospitality initiatives there at the college. She is also leading the tourism crisis management initiative. It's wonderful what they have been doing lately, and we are very fortunate to have them to talk to us about perception of risk on the consumer side. And we also have Dr. Ashley Schroeder. She is an assistant professor at Penn State and a frequent speaker at lots of events and tourism conferences. She is the managing director at the Tourism Crisis Management Initiative. So they're going to talk to us about perception of risk. Their research areas are based on crisis management, recovery, and response. They have done a ton of research in Florida, so we are eager to hear from their research. Welcome, ladies. The floor is yours. Thank you for being with us.
Thank you, Ezra.
Yes, thank you, Ezra. And also to TTRA. Hi to everyone else. Lori and I are pleased to be here with you all today. I'm going to be sharing some insights from an ongoing extensive study on COVID-19 travel risk perceptions that our team at the Tourism Crisis Management Initiative has been working on. I'd like to begin by providing you guys with a brief overview of our study. Our goal in conducting this research is to help organizations in the travel and tourism industry to understand the current fast-changing scenario from a consumer perspective, as well as to provide insights into recovery. We aim to identify trends and provide weekly insights throughout the response and recovery phases of the COVID-19 crisis. We do this by using up-to-date data to understand American travelers' perceptions of risk towards travel, as well as the other variables related to COVID-19. Unique variables include threat appraisal, coping appraisal, trusted source, and a travel anxiety index. We've been in the marketplace since January 26th, before COVID-19 became a crisis in the US. And starting with Wave 4, which was conducted in mid-March, we have transitioned to weekly data collection to capture rapid changes related to COVID-19 in the US. To date, we have collected 8 waves of data, each with approximately 500 or more American travelers. And ongoing data collection in frequent intervals allows us to monitor changes and fluctuations in COVID-19 perceptions of travel risk and other COVID-19 related variables. We've been recruiting members of the American traveling public to participate in our online survey through an online panel. Respondents are screened to ensure that they are adults, current US residents, and have either traveled recently or were considering traveling within the next 6 months. In today's presentation, I will include data from Wave 8, which was conducted earlier this week, as well as show some longitudinal data to help identify trends and changes over the course of the crisis. Okay, so now that you have some background knowledge on the study, let's get into the fun stuff and dive into the data. So first up, we have a series of questions that are designed to understand insights into Americans' anxiety towards traveling in the US and abroad. We've asked respondents to please indicate how they feel when they think about traveling in the US right now, on a scale ranging from anxious to relaxed. Earlier this week, 59% of respondents indicated that they are at least somewhat anxious about traveling in the US right now. In contrast, 23% of respondents indicated that they feel at least somewhat relaxed when they think about traveling in the US right now. Overall, this indicates a relatively high level of domestic travel anxiety. Let's take a look at how domestic travel anxiety levels have changed since early February. This is important to understand because higher levels of travel anxiety may result in decreased travel intentions. When domestic travel anxieties level out or return to pre-crisis levels, this could be an indication that people may be willing to travel again. So in early February and early March, domestic travel anxiety levels were relatively low, but the results also reveal that domestic travel anxiety levels increased between early February and early April, with some substantial increases in those who indicated they were anxious when thinking about traveling in the US right now. Between early March and mid-March, as well as between mid-March and late March, which coincides with the introduction of COVID-19 cases in the US. Interestingly, domestic travel anxiety levels rose again this week after appearing to be leveling out last week. We also asked respondents to indicate how they feel when they think about traveling in the US in the next 6 months. There are some positive indications from the results that we had earlier this week. Compared to their current domestic travel anxiety levels, Americans are less anxious about domestic travel in the next 6 months. Overall, the results indicate more neutral feelings towards domestic travel in the next 6 months than right now. So we can see here the changes in results since late March. In late March and early April, more than half of respondents were at least somewhat anxious about traveling in the US in the next 6 months. Similar to the trend we found with feelings about domestic travel right now, Americans' anxiety with domestic travel in the next 6 months rose again this week after appearing to be leveling out last week. Now we can transition over to understand how American travelers feel when they think about traveling outside of the US. Earlier this week, 47% of respondents indicated that they feel anxious when they think about traveling internationally right now. In comparison, this is higher than the 33% of respondents who indicated they feel anxious when thinking about domestic travel right now. So the results indicate that international travel anxiety levels are higher than domestic travel anxiety levels. We also asked respondents to indicate how they feel when they think about traveling outside of the US in the next 6 months. Earlier this week, 51% of respondents indicated that they feel at least somewhat anxious when they think about traveling internationally in the next 6 months. In comparison, 43% of respondents indicated that they feel at least somewhat anxious when they think about domestic travel in this time period. So again, we see that American travelers expressed higher levels of international travel anxiety than domestic travel anxiety. There have been many predictions about how travel may change post-COVID-19. One prediction is that travelers will be required to wear face masks in public. Prior to COVID-19, this was not common practice in the US, although it is more commonly acceptable in other cultures. And more recently, health organizations and many state governments have begun to recommend, or in some cases require, Americans to wear face masks in public. For these reasons, we designed a series of questions to provide insights into Americans' anxiety towards seeing people wear masks in public and have been tracking changes in perception since early March. Respondents were asked to indicate how they feel when they see people wearing a face mask in public on a scale of anxious to relaxed. Earlier this week, 25% of respondents indicated neutral feelings when they see this. And it's really interesting to note that there is a much greater proportion of respondents who were at least somewhat relaxed when they see people wear face masks in public than at least somewhat anxious. Since late March, there has been a decline in anxiety levels associated with people wearing a face mask in public. During early weeks of the crisis, a greater proportion of respondents indicated that they felt at least somewhat anxious. And in general, our findings indicate that Americans are becoming more used to seeing people wear face masks in public. We have another line of questions that we use in determining which information sources American travelers are turning to for travel-related COVID-19 information and the level of trust associated with various information sources. We provided respondents with a list of several information sources and asked them which would be their number one choice to use to get travel-related news and information about coronavirus. The results indicate that there is no dominant information source, as the most preferred information source at 17% of respondents was other online news sources. The second most preferred information source was network TV at 14% of respondents, which was followed by official health organizations at 13%. Respondents were also asked how likely it is that they will avoid travel if told to do so by various sources. Earlier this week, 85% of respondents indicated that they are likely or extremely likely to avoid travel if told to do so by health professionals, and 80% indicated that they would do so if told by Dr. Fauci, director of the National Institute of Allergy and Infectious Diseases. Notably, respondents are more likely to heed the advice of health professionals and Dr. Fauci than the President of the United States, the US Department of State, the Consular General for the country they are visiting, and state governors. This demonstrates a greater level of trust in scientists than politicians, which is consistent with research that has found an overwhelming majority of Americans agree that we need to hear more from scientists and less from politicians on COVID-19. In addition to the official governmental and health-related information sources that you see on the screen, we also asked about two tourism-specific sources. 69% of respondents this week indicated that they are likely or extremely likely to avoid travel if told to do so by a state travel office, which indicates a higher level of trust in state travel offices than the President of the United States. 56% indicated that they are likely or extremely likely to do so if told by a travel agent or tour operator, which is lower than the information sources shown on the screen. Perceptions of trust can change over time, and the ongoing survey is meant to understand how these trusted sources will change over the course of the crisis. The results indicate that there has been a decline in trust in the President of the US and the US Department of State for this type of information over the past several weeks. In contrast, though, the level of trust in health professionals and Dr. Fauci increased this week in comparison to last. We were also interested in understanding the level of trust in news organizations versus social networks, as we know the important role that social networks do play in travel decision-making. So earlier this week, we found that 68% of respondents are likely or extremely likely to avoid travel if told to do so by their family, while 61% indicated that they are likely or extremely likely to avoid travel if told to do so by TV networks or the prestige press. Notably, respondents are more likely to heed the advice of their family than the President of the United States, and the different media and social network sources that you see on the screen. This demonstrates a greater level of trust in one's family in making these decisions than the president, media, friends, and social media. When looking at the results over time, it's interesting to note that the mean score for likelihood to avoid travel, if told to do so by family or friends, has remained constant over 4 weeks. While for each of the other information sources that you see, there has been a decline in the mean score between this week and last. So now that we've gone over the data, here are our top 3 takeaways for y'all. First is that domestic and international travel anxiety levels rose again this week after appearing that they were leveling out last week. And second is that American travelers are becoming less anxious about seeing people wear face masks in public, which is a continuation of the trend that we saw last week. And the third and final takeaway is that American travelers' likelihood to avoid travel varies based on who's told them to do so, and the results generally demonstrate a greater level of trust in scientists than politicians, social networks, and the media. So we have resources related to our ongoing study on our website, which is listed here on the screen. If you have any questions or would like additional information, please feel free to email myself or Lori. And with that being said, thank you for the opportunity to share insights into the research that we've been doing at the Tourism Crisis Management Initiative, and we look forward to the Q&A session. Thank you.
Oh, thank you, Ashley, and thank you, Lori, for being here. We're going to open it up for the Q&A session, and we can use the chat feature of the Zoom. I'm really curious, Ashley. I loved when you mentioned about the destination marketing management organizations as a trusted source. That's something that we have been talking about as an industry, DMOs, DMMOs, how they place a role as a neutral voice, as a central actor, connecting all the pieces from business to residents to consumers. What are some of the nuances that you have seen, not only from this survey, but from your previous work, working with areas that were faced with disasters and crisis? Like, what are some key takeaways there from a trust component? Because trust is the social currency, and that's where we are headed. But how are you guys looking into that from a business and practice perspective?
Exactly. That's a great question. One thing that comparing these findings over the weeks, trust in state travel offices has actually been increasing throughout the course of this crisis. And it's one of the few sources that we have seen that. I think that the findings also reveal opportunities, though, for DMOs to be building partnerships with health organizations and health officials. And by combining forces, there can be a greater level of trust, and tourism can be involved in communicating a consistent message with what we are hearing from health officials.
Yeah, and I think we have seen part of that at the coastal destinations, especially with South Carolina, when they were dealing with the crisis several years ago. Was there, we got a question from Jennifer here. Could you tell us a little bit about the age breakouts of the study, and if trusted sources changes based on age?
Yes. The sample is representative of the US population, and we weighted the data to ensure that. I personally did not take a look at whether or not trusted source had varied by age. Lori, did you happen to do that yet?
No, I haven't done it, but it's easy enough to run that data. But I would assume, based on previous research, that there would be variation based on age. Maybe one of our first waves actually broke out some of that by age, but we haven't run it consecutively. But the data is available to do that.
Can we also look at that slide, Ashley, where you had the DMO percentages?
I don't think I had the
You didn't
GMO
put it.
one.
You talked about it, I think, when
I
you
talked about it. It wasn't listed, so I
You
can.
have to send us that data point because I
So
think that
it was,
has a lot of application.
yes, it was 69% for state travel offices. So I don't know if you can see my cursor. It would fit in here between the President of the US and the US Department of State.
I want that slide and I'm going to tweet it.
Okay. Thank you.
I think it's so important from a neutral actor perspective and how DMOs are placing and making a difference from a placemaking and as a trusted source for business and travelers and residents. I think when we talk to hoteliers or businesses, they're so focused on revenue. They're focused in the now and their P&Ls.
Exactly.
And sometimes they lose track of what is that long-term sustainable vision is and how can they get to that point, that longevity. And it goes back to aligning interest with business and how DMOs are doing the right things. And there are phenomenal things happening right now in the DMO space from a marketing and management perspective. We have a question here from Bonnie. Given the tour operators' high trustworthiness, are there any ethical issues for tour companies you would share?
Do you want to take this one, Laura?
Sorry, I was trying to find it in the.
It's the second one.
Oh,
From Bonnie.
I mean, I think our research supports the notion that science is more important than ever. And I think for all aspects of the travel industry, that's going to be critical to earning the trust of the US traveling population. So even for tour operators, I think it's going to be important that they're very transparent about the practices that they're engaging in and how they're making decisions about the destinations that they've brokered relationships with and why they're choosing to go to certain destinations. I think demand is going to play a big role in that. And I think we've seen changes in perceptions and decision making is going to not only be driven by some of the conversations about price, but also about the notion that when they go to a destination that they feel like it's a safe destination and that the risk doesn't outweigh the cost, the benefits. And so as they're making decisions about, going specific places and with a tour operator, then I think it's going to be really critical to be very open and honest about the things that that visitor is going to be expected to do, as well as things that the destination is doing for the visitor, and that everybody is committed to the same goal of keeping one another safe, whether that's the destination keeping the visitor safe or the visitor keeping the destination, the employees, and the citizens safe.
Yeah, so looking at safety and security, are you also seeing that as another key performance indicator for destinations or some sort of an indicator for future demand?
I think that in the decision-making process, if we just look at Maslow's hierarchy of needs, that safety is the bottom rung, and that if we can't get past safety, then it's hard to get to self-actualization. And people are not going to make decisions that put their health or their family's health at risk. So they're going to make decisions that's going to become factored in to a greater extent than it has in the past.
Perfect. And I think going back to the travel agency perspective, those places that are really high risk, they could see travel recognition from travel agencies or trying to arrange travel through those trusted sources. It could be a venue. That's definitely possible.
Yeah, and I think that's what Ashley said as far as now's the time to start to forge those relationships with your local health professionals so that you can come out and have, very transparent messages about what you're doing in the destination and how you've got the health professionals at the table with you as you unfold.
Yeah,
So
they
now-
were the highest percentage in trust, 85%.
Exactly.
Another question is from Tom. Do you know how much air travel impacts international travel? Are people hesitant to travel to those countries or afraid of getting on a plane?
Yes, so one of the questions that we've been asking is when tourists decide to travel again, where are they most likely to travel? And it's been around 80% each week that say that they plan to travel in the US, and only about 20% who plan to travel internationally first. We do expect that domestic travel will come back a bit quicker than international travel. We haven't looked specifically at fears over air travel, but I would imagine that that is correlated with the international travel piece.
I thought domestic travel was still high, looking at the anxiety levels between both domestic and international. I thought international will be like literally sky high and domestic will be high, but the difference wasn't drastic.
Not drastic, no.
Another question is from Ali. Hi, Ashley and Lori, great presentation. I have a question. Can we see their anxiety level based on their location?
Yeah, we have run that in the past. We have a few of those posted on our website as well, by geographic region in the US.
So Lori, just a follow-up question on that. Is that correlating a lot with the number of cases we are seeing? For example, there are some states that are so heavy with those cases. So that's correlating or lined up?
Not statistically significant. So I think overall anxiety is high in all of the regions. There are small differences across the different regions, but statistically it's not, there's no difference.
That's interesting. But the patterns are definitely
The patterns are there though, but not enough to, you know, be statistically different.
And I think everything is changing so fast nowadays. The data is changing on a daily basis. We have never seen anything like this. We can't really looking for those like super strict relationships. That's what the patterns are telling us. This question is from Charles. Is there a difference between business and leisure travel? I love this because I'm so onto this. Any difference that you have seen from travel patterns?
We're not looking at business travel. So we're mostly looking at leisure travel and asking about vacation trips. We might have a few in there. I think we have one question, but we haven't run the differences. So we have to go back and look at that.
So based on what you are seeing with the pandemic and some of the crises that you have